Okay, here is Devon and Bear. We're back to do the musculoskeletal um, assessment video. Alright, so musculoskeletal and range of motion is what we're going to be doing here. So we've already identified the patient, checked the armband, and I've introduced myself, Devon, student nurse. I've explained to Mr. Bear that we're going to be doing an assessment of his musculoskeletal and range of motion. So how do we start? Let's see. All right, so we will start with the head. Mr. Bear, I'm going to ask him to turn his head left and right, look up and down to check range of motion of the neck. I will also be palpating the neck, the spinal column of the neck, just to see if there's any abnormalities, anything that feels abnormal, bulges or sores, redness, anything like that. We'll be palpating all of the joints the same way for the same thing and for any pain. So range of motion is intact for this joint at the neck. Next, we will move down to the shoulders. For the shoulders, we would have Mr. Bear raise his arms. Maybe pull them back. We have abduct and adduct them. On the side, we're checking for his circumflexion of the shoulder joint. Also, we will have him lift his shoulders against resistance. All right, so that's there. Also, while we're in this area, we be just checking their brachial pulse and the radial pulse. Yes, we do like this. And the brachial pulse. Okay, then we will move down to the hips. At the hips, we could just have them stand up, sit down, maybe bend over. And while we're doing these, we were assessing for pain, anything that feels uncomfortable, any popping sounds or clicking sounds that you might feel when moving those joints. Okay, then we would just do the elbow. So again, palpating the joint, having the patient flex and extend this joint, assessing pain, discomfort, feeling for anything abnormal. Everything is normal for Mr. Bear. And also we would have the patient flex against resistance and push back against resistance. So Mr. Bear is able to do that. All right, and for Mr. Bear, we would then have him lay down. We're also still assessing the hip and kind of the knee. We're going to do that at the same time. So we're going to have him flex his knee up, bend over this way, out that way. Okay, that's checking the hip and also the knee. So same for this side. Abduct. All right. So Mr. Bear is able to do that here. His knees are being assessed as well. Behind the knee, we have the popliteal pulse. And then on the foot, we have the pedal pulse. And then behind we have about here, I have the posterior tibial pulse. Okay, then we would assess the ankle joint. We kind of have Mr. Bear push his foot up against the hand to check the muscle strength. And we would kind of have him move his foot inward, upward, just to test range of motion, and maybe plantar flex to check range of motion of the foot. We would palpate, feeling for anything abnormal, as well as the knee and all the joints. And then we would do the fingers. For the fingers, we could just have Mr. Bear extend his hands and then kind of put them in a fist. We would palpate his hands and fingers, each finger, feel in the joints, see if there's any swelling or anything there. And then also for Mr. Bear's head, we could actually have him push his face toward resistance to check for strength in this joint as well. And then at the hips, we can have him twist without moving his hips to see how his strength is in that one or in that joint. And then for the leg and the knee, we can also push down on the leg or put some resistance on the leg and have them push against that as well. So I do believe that's it for range of motion. We inspected, we palpated, we checked for resistance in all joints, and we checked range of motion in all joints. All right, Mr. Bear, we're all done with your musculoskeletal range of motion strength test. Here's your call light. I'm putting your bed down to lowest position. Raising the head of the bed to a comfortable position for you. Would you like the side rails up? No? Okay. All right. Here's your call light. Please let us know if you need anything. We'll be right in. I'll be in to check on you shortly. Thank you so much. And that's it for our range of motion musculoskeletal assessment.